Tim Norris from Both Ends of the Lead. What gave you the idea for a business called Both Ends of the Lead doing canine physical therapy?
Well, it started out initially, I had about 20 years experience working with people and always had a great love of dogs and always wanted to work with dogs, so I got myself in a position where I could then start working with dogs.
Yeah.
And then it just seemed to me the natural thing to do is, because quite often you might see a dog that's got a few physical issues, for example, on there, but maybe they're a little bit anxious, a little bit stressed as well.
Yep.
And sometimes you can make that correlation between maybe anxiety and stress in the person or their environment they're in and the dog. So they're kind of interchangeable at the same time. You can't really separate one from the other.
What's the easiest way for pet owners to discover if their dog's in pain, apart from obvious signs like limping?
Yeah, I mean, outside of the obvious signs of, I say, lameness, not weight-bearing, limping as such, looking for maybe changes in their mood. Sometimes they could be maybe like a heightened sensitivity.
Yep.
They might be a lot more reactive than normal. They might not be comfortable if you're actually starting to stroke them or touch them, for example.
Yep. They
could potentially be off their food. There could be things like in regards to their mood swings, for example. And it's subtle little things sometimes, It's such a broad subject. I mean, there's 101 different things, but I would say the main ones to focus on outside of the obvious ones would just be changes in the mood, if they're more reactive in certain situations, if you're stroking them, you can just see they're just starting to pull away or they're starting to flinch a little bit.
Okay.
Yeah, those would be the big ones to be concerned with,
So it's very gentle. I've seen you working on Buddy here, and
Yep.
he seemed to like it a little bit too much. He was rolling over. But look, the one thing I know about the physical side of dogs has to do with sports such as flyball, agility, those kinds of sports.
Yep.
And I know that a lot of owners that participate in those sports, they're always saying, "Oh, my dog's busted his cruciate ligament." What's that? What's a cruciate ligament, and how do you bust it, and how do you fix it?
Well, that's a good question. I mean, bear in mind, dogs that do those sort of activities, they're real athletes. It's high intensity work. So the dog's got to be very specifically conditioned for that, and the right sort of breed of dog as well. Like Buddy, is the perfect breed for flyball and agility.
I've actually seen him do flyball. He's pretty good. I think in fact he was a champion, wasn't he? Where's our owner? He was a state champion or something. Australian champion.
Yeah.
Well, we're in with royalty here, aren't we?
Yeah, absolutely. I mean, as far as the cruciate ligaments, the main sort of ligaments that actually stabilise the knee joint,
Right.
in what they call in that flexion extension, that bending movement as such. You have other ligaments either side as well, which stabilise the knee joint side to side, but these are the main ones that really stabilise the knee joint.
I'm going to be a real smarty pants here. Is that the same thing as a luxating patella? These are all things that vets have told me.
Well, the luxating patella is basically, the patella is actually the kneecap, as I'm sure you're aware, Brian, but it's basically, when it's a luxating patella, is when the kneecap just starts to get pulled slightly out of alignment, and that's generally because there's an imbalance, whether it's some ligaments are too tight, some muscles are overworking, some are underworking, and it just doesn't sit quite exactly where it was, and then you get that degeneration starting to come in then. So
I think Buddy wants to say a few words.
Yeah, sorry, what do you think, Buddy?
So if people want to use your services, how do they get in touch with you? I mean, what's the criteria? Do they need to be recommended by a vet?
It's a real mixture, really. I mean, a lot of people come and see me through the dog activity events that there are, like flyball and agility. There's a number of dogs I work with like that. There are some vets who are aware of what I do and are very happy to sort of pass on details to their clients if they feel that the services they offer are going to be beneficial. You can just visit our website, bothendsofthelead.com.au as well. That gives you more of an insight into what we do, the services we offer, and the typical conditions on there that we tend to treat. So yeah, lots of different ways you can get in contact with us, but the vets is certainly one way of doing it.
Alrighty.
Yeah.
Well, it sounds like it's certainly a therapy, a modality, I suppose we could call it, that's going to be out here in Australia. Your accent tells me you're not from these parts. Are you going to stay here?
Oh yeah, of course. Yeah, no, it's a nice part of the world to be in. So absolutely, as long as people can still understand me, then
right. Well, put subtitles on.
Yeah.
Thanks, Tim. Bothendsofthelead.com.au. Thanks a lot.
Thank you, Brian.